Your newborn baby is experiencing severe hiccups. They're kind of adorable, but you're also wondering if there's anything to worry about. Hello friends, welcome to our YouTube channel, where we discuss topics related to health, pregnancy, and motherhood. Without further delay, let's check out newborn baby hiccups, causes, cures, and prevention. Let's start with why do babies get hiccups? The diaphragm contracts and the voice cords quickly close, which causes baby hiccups. The hiccup sound is made by the vocal cords rapidly shutting. You would suppose that since hiccups typically bother adults, they also upset infants. Babies, however, are usually unaffected by them. Hiccups rarely affect or interfere with a baby's breathing, and many infants are able to sleep through them without being awakened. How to stop baby hiccups? You can try these things if your baby doesn't show any signs of reflux. Take a break and burp. To stop hiccups from occurring, burp your baby while they are feeding. Use a pacifier. Sometimes pacifiers can stop hiccups. The diaphragm can relax thanks to the sucking motion due to pacifiers. Adjust your feeding postures. Try feeding your baby more uprightly next time. Let them stop on their own. Babies up to 12 months will hiccup fairly often, so letting them be is probably your best bet. More often than not, your baby's hiccups will stop on their own. How to prevent hiccups in babies? It is challenging to totally prevent hiccups. But try the following methods to help with hiccup prevention and for overall healthy digestion. When feeding your newborn, make sure they are calm and not moving much. In other words, start feeding them before they start crying because of hungry. Avoid intense play or activity with your baby after feedings, such as jumping or rocking. After every feeding, keep your newborn upright for 20 to 30 minutes. When are hiccups cause for concern? Hiccups typically don't disturb infants. But occasionally, hiccups indicate gastroesophageal reflux disease. Acid from the baby's stomach backs up into the esophagus due to reflux. Infants with reflux also have signs such as coughing, spitting up, irritability and crying, arching the back, especially during or after a feeding. If you observe these symptoms, consult your doctor to determine whether your infant may have reflux and the best way to treat it. Conclusion: don't worry. Babies are not uncomfortable by hiccups because they stop on their own. Therefore, don't feel that you must treat them. Thanks for watching. We upload frequent new video related to your common health and food related questions, and if you're new on our channel, then don't forget to subscribe and click the bell icon to get new video updates.